The Vein Clinics of Hawaii radio show was previously recorded.
Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, aloha and welcome to our program. You know, this is a show that lets you know how you can really take a real good a look at what your lifestyle is, what your enjoyment of life is, particularly as we start aging. Everybody knows that, oh yeah, you got to be in good shape for this, you got to be in good shape for that. A lot of the stuff that we talk about is you got to get up on those legs and do your thing. And most of the time when we talk about vein issues or artery issues, we're talking about the legs. Mainly, and we'll tell you geographically, well, that's important in a minute. Dr. Randall Juliff of Vein Clinics of Hawaii has joined us again, and I often say well, we're going to talk about your circulatory system and all of that. And because I'm a patient, I just assume that all of y'all out there know exactly what we're talking about. But this is going to be Basics 101. Arterial insufficiency. What is that, and what is venous insufficiency? Insufficient, does that mean there's not enough? Maybe it does. Anyway, Doc, that's kind of a roundabout intro, but hello there again. And what does circulation mean?
Yeah, that's a good question. We get that all the time. And people will come in and they'll say, well, my doctor said I have poor circulation. To most people, circulation, when they make that comment, I have poor circulation, often it means not enough blood getting somewhere, and that has to do with arteries. But so the circulation is arteries and veins and everything in between. The heart pumps, and it pumps blood through arteries, and the arteries carry blood throughout our entire body, and basically what that, the primary thing that the arteries are bringing is blood filled with oxygen, and oxygen is being distributed to, every cell within our body, basically. So, arteries, the biggest artery in our body, the aorta, leaves the heart, and then it goes through a number of different cascades and, different levels of branching, et cetera, and ultimately, oxygenated blood gets to every part of our body. Well, then that blood has to come back, after it goes through the capillaries and the tiny, tiny little connections between the arterial system and the venous system. I often tell people it's kind of like a tree root, the very most peripheral part of our circulatory system. The branches are very, very tiny. Some of them are just a single cell layer thick. Things go in and out of the blood, and again, most notably oxygen. So that blood has to have a way to come back to the heart, and that's through the veins. The blood goes through, again, the capillaries and something that we call venules, and which are just tiny, tiny veins, and then the bigger veins. The biggest vein in the body is called the vena cava. That's a huge vein that runs through the middle of the abdomen and pelvis and up into the heart. And then blood comes back to the heart, gets pumped to the lungs, and then goes through the whole thing all over again.
So let me tell you something, Doc, that I think that the audience would love. A couple of shows ago, we talked about how much blood most of us have in our system. If you're a little tiny kid or a big guy, there's a certain amount of blood that you have, and it's not all that much. Right. And what we learned in the previous shows is that this whole system is in a hurry all day, every day, because that blood literally goes through your system. I don't know how many thousands of times a day you told me, but it's a pretty busy factory even when you're sleeping.
Right. Yeah, it is. It's amazing. I mean, when you think about it, especially, the heart. The heart, basically, the heart's just a muscle. It's a muscular pump, and it is going every day of our life.
It doesn't get a rest. No vacations.
It does not. And if you've ever worked out and you're doing like curls or whatever, you know that your muscles, your skeletal muscles, they wear out after a pretty short period of time, especially for me. But the heart does not. And we have about 5 or 6 liters of blood in our body. A liter is a little more than a quart. And in that entire blood volume, we call that the blood volume of the body. That entire blood volume gets pumped through. It circulates about every minute or so. So it's a tremendous mechanism. And it's amazing when you think about it. I mean, I'm still amazed at heart and circulation and how it functions, and how it just continues day and night for our entire life. It's amazing
gang, I am not just a little bit interested. I'm flabbergasted at the uniqueness of this whole deal. And no matter what we go through in life, you talk about technology, and I was looking at something the other day, Doc, that you get a kick out of, and that was in the year 1955. None of the stuff that we use today was even around, and we still made it through everything. And it just constantly reminds me about your profession, gang. Am I the host of the show with Dr. Juliff of VeinClinicsOfHawaii.com, but I'm a patient, and I think that what I've learned in a short period of time, that it's hereditary and all of that kind of stuff, the symptoms and whatnot that you have for this insufficiency that we're talking about, it varies a little bit in all of us, but isn't it absolutely fascinating to me that there's so much going on in there, and you've been able to isolate how to repair things on the fly. I mean, literally, you get in and do a vein job or an artery job on somebody. They're not on vacation or out of the country when that's happening. They're using that stuff at the same time you are. That's why surgery to me is so fascinating.
Yeah, it is. I mean, often we have to, often we're surprised. We don't like to be surprised, but, most of the time we know exactly what's going on and exactly what we're going to need to do. Which is one of the things that kind of drew me to, vascular and cardiac surgery. In general surgery, often you're doing kind of what would be referred to as exploratory surgery, where you're, going into somebody's abdomen and trying to figure out what's going on. Vascular surgery, not so much. We have things pretty well defined, but so, in comparing arterial insufficiency to, going back, so we have the circulation, and the circulation is arteries and veins. And you can have problems on either side of those. You can have problems in just the arteries. And that's going to create its own, little group of issues. Or you can have problems on the venous side. And even though they're both blood vessels, they're very, very different. And they create very, very different, symptoms and problems. Some people, although it's surprising, most people have either one or the other. If they have circulatory problems, usually it's one or the other. A small number of people are so lucky that they have problems in both. But luckily we can, take care of most of the things that happen. But
but going back to what you were saying earlier, though, and maybe because people they're finding out today the difference between the veins and the arteries, is that at the bottom of the system are these tiny little things.
Yeah.
So in other words, the artery pumps all of this blood out of the heart, and it shoots it all over your body, and it all gets collected by these things that are like, they're microscopic.
Oh yeah.
Seems.
Exactly.
That's amazing.
Yeah, it is amazing. I mean, when you think of an artery or vein, you think of something that you can see and hold and, that kind of thing. But yeah, at the very, very peripheral spots within our body of the circulatory system, there are tiny, tiny little, arterioles and venules and, the walls of these things are like a single layer thick. So they are definitely microscopic. microscopic. You can't see them. And really, most of the important things are going on at that level. I mean, the heart's pumping and blood's going all over the place. But as far as oxygen transfer and, nutrients being distributed and all that sort of thing, that's happening at the very, very periphery in those tiny, tiny little blood vessels. It's amazing.
You've said many times in the past, and I know everybody loves to hear this answer, and that is, there are various tests and various procedures you do to determine which of these systems needs help. Are the symptoms or the signs similar if it's a vein problem or if it's a artery problem, or are the symptoms completely different?
Yeah, they are very different. Now, some of them are kind of gray. Some of the symptoms can be either one or the other, but for the most part, luckily, people come in. They come in complaining of a specific, set of symptoms, and usually we can figure out what it is. So, in arterial disease, the problem is an obstruction of blood being pumped through an artery. And that typically occurs because there's plaque buildup, and I think most people have heard about plaques in arteries, and we'll talk a little bit more about that in a second. But plaque builds up, and there is an impedance to blood flow getting through that artery that has a blockage in it. Now, as opposed to veins, where the basic problem is not a blockage. There is a flow problem, but the problem with when it comes to venous insufficiency is that the flow problem is that the blood, it's not that it's going too slowly in the right direction, it actually starts to go in the wrong direction.
Okay.
And, in our legs, that becomes particularly important, and that's because of the fact that, veins rely on these tiny little one-way valves that keep the blood moving in the right direction. In our legs, the right direction is upward back to toward the heart, and as those valves fail, the blood starts to go in the wrong direction. It kind of settles down into the leg, and that's what creates the symptoms of what we call venous insufficiency. So the most common symptoms of venous insufficiency are achiness, heaviness, and fatigue. Those are nearly universal of people who come in, with substantiated venous insufficiency. Usually, some form or another of those three symptoms are present, and those are the symptoms that are most reliably relieved when we treat those patients.
Yeah, gang, this is kind of important. One of the things that I wanted to make sure you got it was that the reason why we spend so much time on this, and some people say to me, Doc, how do you guys talk about veins for an hour? We talk about veins for a month. I mean, it is such a fascinating deal. But here's the deal. It seems to me that the arteries, no problem. They don't have valves because they don't need them.
Right.
That big heart just pumps that fresh blood out of there and sends it all over your body. So it's a gravity deal more than anything else, right? But how does it get uphill? In other words, here's my heart. My hand's on my heart right now, and I know it's very important to get this blood to my brain. Yeah. How does it go up? How does it go uphill without a valve?
Yeah. Well, it doesn't. I mean, when the valves fail, they it does not go uphill. But since we don't have thousands of little hearts all over the peripheral part of our body pumping blood through veins, they rely or blood flow through the veins relies on two things mainly, and one of them is those one-way valves. They're so incredibly important. The other thing is something that we often refer to as the calf muscle pump. So, when we're walking around or when we're sitting and we're just kind of moving our legs and that kind of thing, the muscles in our legs are contracting, and what happens is that the muscles contract, and when that happens, the veins get compressed. And as that vein gets compressed, the blood's got to go somewhere. It's going to move. It's going to move either up or down. If those valves are functional, then they're only going to allow the blood to go upward and stop it from coming back down. But again, the problem in venous insufficiency is that those valves fail, and even though our muscles may be working normally, the blood is not, getting pushed in the right direction. It may be getting pushed downward, and again, that's what causes the symptoms of venous insufficiency.
Yeah, and folks, that's really why we do this program, because I don't care if you light up with one or another of the symptoms. Once you become aware, this could be this, there could be that. My big fear is always this, not just as a patient doc, but I hear this from other people. The more trouble you have with your veins, let's say that you have really bad venous insufficiency, and it's everywhere, it's in both your legs, it's all over the place. Doesn't that mean that blood that needs to get uphill to get serviced and recharged to come back downhill, you're in in likelihood of not being able to get that blood quickly enough or often enough to keep you living?
Well, yeah. Luckily it usually does not get to that extent, and the way that I kind of describe that to people is that, as they develop valve failure in the veins and develop more and more venous insufficiency, the legs become kind of a reservoir for blood. So, the blood will eventually come back up to the heart in one way or another. It's not like it's just an unlimited amount of room down there where the blood is all going to, settle. But there's a lack of flow, of efficient flow, I guess would be the word, upward, and because of that, then there's too much blood hanging out in your veins, and as the volume of blood increases in your legs, then the pressure within the venous system increases, and then that's what then causes the more advanced problems that we see in venous insufficiency. But that process can be even seen in normal vein, people with normal veins. For instance, when they're at some event or at some kind of ceremony type of thing, and everybody's got to be standing in one position for a long time. Occasionally somebody passes out. Well, the reason they're passing out is because, the blood is kind of, settling down into their legs because they're not moving. Even though the valves within the veins may be working properly, the muscles aren't contracting, moving the blood. And in a sense, kind of the scenario that you described, can that happen? Can that get close? Well, it can, and that's somebody passes out. Well, luckily, when they pass out, they lay down, and that then allows for the blood to kind of go back down. And that's why we often say, gee, if somebody passes out, the first thing that you should do is elevate their legs. And the reason for that is because they probably have accumulation of their blood volume in their legs, and that needs to get, we use gravity to get it back down into their heart.
That's absolutely fascinating, gang. I had that actually happen. I was at a function, and one of the things that I knew, because Doc and I have talked about me and many others, is sometimes getting up too quickly or whatever is all it takes to fall down. Right. I mean, because you're in that thing. Well, that happened. I was actually emceeing at a function just before the pandemic hit, and it was my turn to get up and go back up to the stage. Somebody was finishing up, so I got up nice and slowly, like I always do, and the guy that I was going to introduce got up and went straight down, boom. And I did exactly what, I don't know what it was. Maybe it was the Julef training or whatever it was. But I grabbed this guy's legs right away and I tilted him up. And the guy that was sitting next to me said, "What are you doing?" I said, "I don't think he's in a good circulatory position right now. We have to help this guy out." And then 10 seconds later, he popped up and he was just fine.
Right.
Wow.
Yeah,
that's spooky.
Yeah, and when that happens to somebody, many people may have the impulse to help that patient get up, and that's what you should not do. You need to do exactly what you did, Mike. So that was a good job.
Yeah, it was my training. It had nothing to do with instinct. But see, that's the other thing, and I know that you're going to get into this, but symptoms tell a lot, and if somebody tries to dismiss a symptom, particularly if they have more than one or two or three about a condition, isn't that really ill-advised? I mean, if you get dizzy, somebody's trying to tell you something.
Sure. Yeah, exactly. Yeah, and so some of the other symptoms of venous insufficiency, achy, heavy, fatigue, those are the three most common, but there's a bunch of other symptoms that people may not normally associate with vein disease, but swelling, especially chronic swelling in your legs that does not go away, muscle cramping in your legs, that can be a symptom of venous insufficiency. Something that we call restless leg, and that's where people kind of move their legs around a lot, and that goes back to that calf muscle pump. When we're when we're moving our legs, we're contracting muscles, and that helps vein flow. Throbbing in our legs especially when we first go to bed. All of those things can be symptoms of venous insufficiency. Some other ones are tingling, numbness, and pins and needles. Now, those are more related to nerve kind of things, and those are symptoms that can really cross over between venous and arterial symptoms. Numbness. And pins and needles, tingling, that kind of thing can also happen in arterial insufficiency. So, we make note of that. But, the other things that happen in vein disease that, many people don't know are related to vein problems are all the skin things that can happen to the lower legs, the discoloration, the thickening of the skin. The skin gets very rough and irregular, and then eventually skin breakdown and chronic ulceration, which we talk about all the time. But there's so many people out there with ulcers, healing problems, tissue breakdown, skin breakdown in the lower part of the leg that is very, very likely due to venous insufficiency, and they just don't know it.
Yeah, and gang, we're kept alive thanks to medicine, I guess, for a lot longer than we used to be. But along with that comes from consequences, and some of these consequences are what we're talking about. And that's why I think that most of us, Doc, and I know this happened in my case, and we've talked about this before. A lot of times people just shrug and they say, well, that's what my dad had. So I guess I'm just getting a little bit older. It seems like so many people are accepting of these symptoms rather than angry. I mean, if somebody came into your office and says, hey, Doc, I don't want to seem like I'm really mad, but I'm really mad. I can't do what I want to do. Fix me. What's wrong with me? Isn't that actually a good place to be?
Oh, yeah, absolutely. And yeah, you're right. People find a lot of different reasons as to why they're having, symptoms and problems that they're having. And they blame it on genetics a lot. I can remember one patient not too long ago that came in with just, terrible swelling in his legs that, was there for a long time. And he chalked it up to genetics. He said, yeah, my dad was like this, and I've got brothers, and everybody's got very, very big legs. But most of the time, something that doesn't seem normal is probably not. And, if you have a symptom that, is at all concerning, then typically you should have it looked at. Absolutely.
Yeah, but herein lies part of the difficulty that I've heard, that people that are now patients, they no longer reluctantly dealing with it, but almost every specialty has some medicine somewhere where you can go in and get a monthly injection or take a pill or do this. And I know that there are a lot of people working on that for the venous system, but there aren't really over-the-counter or even prescription drugs that will reverse it. I mean, isn't that sometimes frustrating and alarming? And isn't that a mountain that's got to be climbing? We've got to figure out a way to do that someday.
Yeah, it is frustrating because, there's a lot of, marketing dollars that go into, the so-called remedies. And there's plenty of them for varicose veins and, vein problems and either naturopathic or other, medication kind of things. And, it doesn't really do anything. It may treat the symptoms a little bit, but it's not treating the problem, and it certainly is not going to correct it. Venous insufficiency as well as arterial insufficiency, by and large, it's a mechanical problem, And, it requires a mechanical remedy. And with venous insufficiency, I think you mentioned before that, unfortunately, there's not a lot that we can do for it otherwise. It's not like we can, exercise more, change our diet, take a pill, et cetera. It's not going to have an impact because primarily it's a genetic process, and typically it just gets worse with time, unfortunately.
Yep.
As opposed to arterial.
Yeah, okay. Now, I was going to say now, as opposed to arterial, I'm waiting for this one. I've been waiting for this one.
Yeah. So, the good thing about arterial insufficiency is that, there are a number of things that we can do to, try to make it better, or certainly to decrease our risk. I mean, there's plenty of things that we can do lifestyle-wise to change our risk of arterial insufficiency that we can't do in the same way with venous insufficiency. But, let's talk about symptoms. The symptoms of arterial insufficiency, pain. As it can be in venous insufficiency, pain is one of the early signs of arterial insufficiency, especially in our legs. And the pain that we get with arterial insufficiency is something that we call claudication. And
claudication.
Yeah.
Oh, a new word for me. I got to write it down.
Yeah, claudication. So, claudication is the name, the medical term for the pain that occurs when we don't have enough arterial blood flow. And basically what that means is that we don't have enough oxygen getting somewhere. And with respect to the lower extremity, claudication implies a lack of blood flow getting to muscle. And when muscle is being used, when we're contracting muscles and there's not enough blood flow and oxygen getting to that muscle, then the muscle starts to scream. It says, "Hey, what's going on here?" And we feel that as pain. So the probably the most common scenario is somebody comes in and they complain of calf muscle pain that occurs after they when they start walking, and we gauge how bad that situation is by the length of by the distance they can walk before they have symptoms. If somebody comes in and says, "Oh yeah, I can walk half a mile and then my calf gets a little sore and I stop for a minute or two and it goes away." So that would be that's fairly mild. But it does indicate some arterial problem that we need to evaluate, define, follow in the future, et cetera, that kind of thing. But if somebody comes in and says, "Gee, doc, all I have to do is walk across the house and, my calf is cramping up and it's painful and, I have to sit down." So in that, they say they have to sit down because that's what happens as soon as they sit down and they rest that muscle. Then typically the pain goes away. And that's sort of the definition of claudication, muscle pain that happens with exercise that then goes away with rest. Because when you rest, the muscle doesn't need as much oxygen.
And there's another thing that I'll ask you about this because I know there are people out there that want to know that. And by the way, gang, we only cover the tip of the iceberg on these shows because they're only an hour. You can learn a lot more online by going to veinclinicsofhawaii.com, veinclinicsofhawaii.com. A lot of frequently asked questions. There's some shows there. There's a lot of things that will help you understand where you are, because I think that, we see so much stuff on TV now, Doc, and particularly with things like blood thinners. When you talk about clots, if you're taking about a bunch of blood thinners and you also have insufficiency, isn't that another big alarm? Because you got to have something going slow enough to clot. If it's all going through your system really quickly, guess what? No clots.
Right. Yeah, well, that's another problem that can arise. Well, either with venous or arterial. Now it happens more often in venous. That's where we typically see DVT blood clot. But blood clots can form in the arterial system too, and one of the reasons why it does is very sluggish flow. You're absolutely right. So some of the other symptoms are, the skin. If we have arterial insufficiency, the skin in the feet become pale. I mean, that's one of the signs that we look at. Usually our
Pale.
feet.
Okay,
Usually our feet should be, warm and red, and when there's something that we look at, it's called capillary refill. Capillary refill means that if you put a little pressure on anywhere, on your body, but if you put a little pressure, for instance, on your big toe, the skin where you put the pressure is going to become pale because you're squeezing all of the blood out of that skin. But then when you let up, it should, that redness, that red hue from the blood coming back in should happen pretty quickly. If it's very, very sluggish, that can be an indication of poor blood flow. So that's one of the things that we look at when we examine people. But just in general, people can have pale skin in their feet, the furthest away from your heart. People can have a loss of hair in the lower leg and the feet. That's another, common sign of what we call arterial insufficiency. The skin can become very thinned and shiny. So that's kind of another sign that we get used to looking at and seeing, as opposed to venous insufficiency, where the skin tends to get, kind of this bluish hue, and the skin doesn't thin out and becomes shiny. If anything, with time, the skin in chronic venous insufficiency becomes thickened and rough and fibrotic.
Interesting. I'm sorry, but interesting that you say that, because I want to relate that to an experience I had in your office not too long ago, having a ultrasound test, because that's what happens sometimes. You block temporarily the flow with that instrument, and then when you release it, that blood that you block goes shooting up, so
right.
You can see sort of. In other words, I didn't realize until I had the test exactly what that test was saying. Okay, so if you have a permanent block, that means that blood that's supposed to be going there isn't. And if it can't get uphill, you that's where you get problems. So isn't that an interesting way to diagnose all of these symptoms that you're talking about? Once you finally get a patient into that ultrasound, hey, the reason why you did this and did that is here. You can see it.
Right.
It's what a valuable tool that's become, hey?
Oh, yeah. Yeah, definitely. And we use ultrasound every day of the week to look at venous function, but we can use that same test in a little different way to look at arterial function too. So, which is something also we do every day. We can, we're very adept at also defining and diagnosing arterial insufficiency. So if somebody comes in, which sometimes happens, somebody comes in with symptoms that are not completely clear, we can usually figure it out by looking at both sides of the circulation with the ultrasound.
Yeah, I think that's great.
Some of the other symptoms are coolness. I mean, the foot becomes cool. So if the skin is pale and thinned and not a lot of hair, and it feels a little cool, then there probably is not enough blood getting down to that part of the extremity. Erectile dysfunction also can be a sign of arterial insufficiency. Doesn't happen very often, but ED. One of the causes of ED is arterial problems that sometimes can be improved just by addressing the circulatory system. And then probably with respect to pain again. Some people have what we call rest pain, and that means that they don't even have to walk or exercise. They can start to have pain if their arterial insufficiency is very, very bad. They can start to have pain actually at rest. And often, where we see this, the scenario that people come in and report to us is that, when I go to bed at night and I elevate my leg and I'm laying flat in bed, I start to have pain in cramping in my feet and toes. Again, all that person needed to do was elevate the leg a little bit, and that caused an adequate decrease in blood flow such that they started to have symptoms. And the textbook scenario is that some of these people will actually sleep with their foot over the edge of the bed because the foot has to be down in order to get enough blood flow to it. But again, that would be a very advanced level of arterial insufficiency because of the blockage that is occurring in those arteries.
Yeah, gang, it's incredibly valuable to sort of know these things, because not only did we start today by talking about the arterial insufficiency, venous insufficiency, but now it seems like now that we're muddling through a lot of these talking points, that they are significantly different. You said there are a few that overlap, but there are some that really are an indicator of one to another. And after a patient is sort of in tune with that, it must be a lot easier to say, pick up the phone, I think I need to see the doc again because this symptom's returned.
Right. Yeah, typically it's not hard to identify people. They come into the office, and I mean, just by looking at their legs, we have a pretty good idea about what may or may not be going on. And then when they start to talk about the problems and the symptoms that they're having, usually it's pretty clear as to whether it's one thing or the other. But sometimes not so much, but we can figure it out in one way or another. So,
yeah, unfortunately, every now and again, somebody points a finger and say, I really like you and Doc Show until you start telling me some of the things I do are not good.
Yeah.
Nobody wants, listen, I've been there and done that. Nobody wants to hear that.
No.
The biggest excuse I tried to come up with excuses, you saw right through it. Why not to wear the compression socks? Because you need to, and some of these other things. But I saw something the other day on TV, and I know you've probably seen this. And this was a lady that I guess was in her 50s. And she was in stage 4 lung cancer, and she had a little hole in her throat that she was breathing through and smoking through. And so that must mean that sometimes people are going to put a pleasure or a habit in front of their health. But I would imagine when some of these people can identify where the risk factor is, they turn around and say, Doc, I wish I'd have known that earlier because I feel like $1 million now because I quit doing this or because I started doing that.
Right, yeah. You hear those stories, and we see it all the time. I mean, and you mentioned one thing that we have a very hard time getting patients to be compliant with, or getting some patients to be compliant with, and that is the compression stockings. People come in and they have problems, and we try to fix them. We try to work with them, but they're very, very reluctant to do what they know they need to do, but we just keep encouraging them.
But Doc, I really feel this. And I mean, I don't need to be congratulated on doing it now because it's part of my day. I mean, it's just like, and it's you. I mean, you don't need them, but you do. You wear them because you don't want to need them. But here's the thing: I'm so glad that it's come kind of in a mainstream, because I know you're seeing this too. But it depends on what sport you're buying equipment for. There's a lot of people that are realizing that not necessarily for venous or arterial insufficiency, but for longevity, for strength, from getting re-energized when you're in athletics. It seems to be that this compression makes sense. Hallelujah, the world is waking up here.
Yeah. I mean, in addition to pathology, in addition to people who have vein issues or whatever, we have found that compression is good in exercise. We sell something in the office that are called sleeves, and those are, it's compression. It's a compression garment that goes over just the calf. It doesn't go over the feet. Now, typically I do not recommend that for people with venous insufficiency, but for athletes, we have found that actually that compression sleeve helps them with muscle recovery. If they're running and whatever for a long period of time, the compression seems to help to get rid of the bad things that have built up in that muscle, which normally occur as the muscle is processing oxygen and that kind of thing. So
it's kind of interesting, like let's say that you're doing push-ups or you're doing bench presses. Yeah. The reason you can't do 50 is because those muscles get tired.
Oh yeah, exactly.
And so that I've always used that as an example. You know what it feels like when you've just done a set. You need to recover.
Right.
Well, that's what I've said to others that are doubting me about my compression socks. When they see them, I say, you know what? They may not look that fashionable, but man, my legs feel pretty good. And they have broached the fashion point a little bit. At least you can get them in a couple of colors. It used to be,
Yeah.
would you like the ugly black ones or the ugly black ones? No.
Right. Yeah. Exactly.
Anyway, but I think it's interesting continuing along how some of these risk factors really can make a difference down there. But what does it mean?
So we talked about risk factors in arterial disease versus venous, and there are a number of things that we can actually alter in our lifestyle to hopefully avoid or lessen the progression of arterial problems. But things like smoking. I mean, smoking is a huge risk factor for arterial disease. We have found over the years that people, who smoke, those are the people that develop, vascular problems. They develop not only arterial insufficiency of the legs, but they develop, circulation problems to the heart itself, and they have heart attacks, or to the brain, and they have strokes, or to any number of things. The link between smoking and vascular disease, I mean, there's no question in anybody's mind at this point that there is something to that, and those when we see people with vascular disease, invariably most of them have been smokers. So there's just so much. There are just so many reasons to stop smoking, but vascular problems are one of those things, and smoking is a risk factor. If you can eliminate it, you're going to be obviously better off when it comes to your circulation.
It's fascinating, and like you said, I knew the next word was going to be diabetes.
Yeah.
And I think that they kind of tumble on one another. And do you notice it's interesting when somebody has a risk factor that they quite often have more than one?
Oh yeah, because I think that what you're relating that to is that so many of them are interconnected. Diabetes is diabetes and obesity. Those are, two risk factors for arterial insufficiency. And so often, diabetes and obesity just go together so hand in hand. If you address one, if you're addressing one, you often are addressing more than one, and in many cases you can eliminate it. Look at the number of people when they go through bariatric surgery and they lose a lot of weight. How they can actually eliminate diabetes from their medical problem list completely. But if you have diabetes and it's not necessarily related to your weight, what we have found is that you really have to control that diabetes very, very strictly. And the more strictly you control your diabetes, control your blood sugar, take your medication, stay on a diet, etc., you will at least lessen your risk of vascular disease as much as you possibly can. If you don't pay attention to that, then that becomes even a greater risk factor for developing arterial insufficiency.
What I think is easy to explain to some people is, as you back out of some of these risk factors, you also back out of more of them. In other words, if you are a diabetic that smokes, that's overweight, that has vein issues, I mean, one begets another. If you clean up one end of the field, the whole thing gets cleaner. I mean, isn't that kind of neat when a patient comes back after going through procedures and having vein surgery and getting themselves back on track, that my legs won't hurt anymore, so I can walk a little bit. Because I walk a little bit, I lost a little weight. Because I lost a little weight, I stopped eating the stuff that made me gain weight. I mean, boy, whoa, this guy's had an epiphany. Good for him or her.
Yeah, it really is that way. And I think the important thing is that it can be that way. People have to realize that, they really can make an impact on their overall health and ultimately their quality of life, because that's what that's the bottom line right there. But
let me tell you what one word, when you sent me the list of some of the risk factors we're talking about, there's a whole bunch you can do about most of them, but this one that says age is a hard one to reverse the flow. In other words, I do know that at some point in time in your treatment and your evaluation of a patient, in their 20s or in their 80s, somewhere is where age becomes yet another thing that you need to take a look at to make sure that you get rid of some of the other risk factors because you are at, quote, higher risk.
Yeah. Unfortunately, there's not much you can do about that. But age, age is a risk factor for, or what we would refer to as a risk factor for arterial disease. Age is a risk factor for venous disease. So, I think it's just the longer we live, the more likely other bad things are going to happen to us, So
there's one guy that is a regular listener of ours. His name is Frank, and if you're out there, Frank, I know how often you listen to this program. He was talking about things like I didn't really get it when it was related to age, and that you said before that this creeps up over a long period of time. But and still, one thing helps to heal another one. Like you said, face it, the age is going to get you. But if you do some of the other things, and this is what he's talking about, if you do some of the other things, it's like every little time is a bonus, and you can do more. And this guy says the whole thing is because he's still trying to work. He's tired, his legs are sore, but he needs to work. So his goal was to get rid of his venous insufficiency to the point where he could stand up for another hour or two during the day, make money.
Yeah. That's unfortunate, and as I guess our economy as it goes on, as it's evolving, just the state of our economy, unfortunately people are having to work longer, and that's a consideration too. When you're in your 40s and 50s, you should probably be thinking about, what can I do to maintain as healthy a lifestyle as I possibly can, because I may need to be, functional enough to work until I'm 70 or 75 or whatever. There's a lot of people, unfortunately, there's a lot of people in that boat.
Yeah, and gang, in order not to be in that boat, you got to go to veinclinicsofhawaii.com and check it out. One of the things that we try to talk about, and that's why I knew that we're going to get into this, but, even if you have a lot of these risk factors that you talked about, I want to know why does it happen? Why are some of the things that happen, like when you talked about earlier, you talked about plaque. This is not the kind of plaque that's on your teeth, but it's similar,
right.
Isn't it?
Well, it sort of is, yeah. But plaque is what arterial insufficiency is all about, and plaque is what starts to limit blood flow through an artery, and when you look at an artery, it's not there's no mystery. I mean, when you for instance, if you're looking at an artery, or if you open an artery, you can see where that plaque buildup in the wall of the artery is, and it's interesting because from an anatomic standpoint, plaque tends to build up in specific locations, and for instance, when somebody comes in with a stroke and we look at their carotid arteries with the ultrasound and then angiogram, etc. It's a very, very typical location where that plaque builds up and then becomes a problem. Same way with the heart, in the legs, everywhere. It's kind of interesting, but for some reason, various areas, various sites within the arterial system are more prone to developing this plaque. So what is plaque? Well, a plaque is a buildup of various substances within the wall of the artery, and there's several layers within the wall, and that this plaque builds up in the middle layer. And the plaque is made up of mainly fat molecules, cholesterol, calcium, these types of things that again, and sometimes the plaque, and often because of the calcium, the plaque can be very, very firm. Sometimes it's when you're cutting through a plaque, it feels like you're cutting through bone. They can be extremely hard. But as that plaque gets, thicker and thicker in the wall of that artery, the more it's going to limit the blood flow. So, that's a process that we call, atherosclerosis. Many people over the years have referred to it as hardening of the arteries, and that's actually a very
big catch-all,
very well put phrase, because those plaques can be very, very hard. Interestingly enough, plaque formation, at least in the United States, that's something that starts at a very, very young age. And it's, probably very dependent on, cultural things and, cultural dietary things and, that kind of stuff. But, even in our teens and early 20s, when you look at the arteries of, deceased individuals in those age groups, you can see the initial stages of some of that plaque formation. So it's something that starts at a very, very young age. So, another thing to think about, young parents, your children are not, they're not bulletproof. It is very important to start, good dietary habits at a young age and, get them kind of used to, eating a specific type of diet. They need to be, kind of encouraged to, not do bad things like smoking, even though they're in their teens or early 20s, it still makes a difference. So, we have to keep that in mind.
And it's important, gang. I drop in on you all the time just to let you know that a lot of these things that we try to cover in this hour that we do, and we're glad to have you as we always do, you need to go to the website and look at it, because each single word that Doc's talking about, there's way more. We tried to it's like putting 20 pounds of rice in a 10-pound bag every week. It just can't be done. We try, but we're getting through about a third of what we'd like to discuss every time. That's why you got to be a regular listener, right? They got to come back next time and next time after that.
Absolutely. So, as these plaques get bigger and bigger, then obviously, like I said, it's impinging more and more on the amount of blood flow that's going through the artery. And typically, our cutoff is, kind of if we have to put a number on it, it's about a 70% narrowing of an artery that will start to limit the blood flow through that artery. So, which is pretty amazing when you think about it. You can decrease the amount of flow by 70%, by almost 70%, and the patient still may not have substantial symptoms. But again, after that 70% mark, then it becomes important. The amount of blood flow that's being limited. It becomes, significant, medically important, and typically we're going to think about doing something if they're having, appropriate symptoms. But so that's what we look for when we're doing ultrasounds. We can measure that. We can use the ultrasound machine to measure the percentage of blockage that we see in an artery. And that gives us an idea about which way to go with things, how to treat it, when to treat it, how urgent is it, et cetera. The lack of blood flow is really, the crux of it is a lack of oxygen, because our every cell in our body needs oxygen to form energy, to stay alive, to do what that particular cell is doing. And when a part of our body is not getting enough blood, it's not getting enough oxygen. And the word that we use for that is ischemia. So ischemia is another word for the day.
Okay.
Claudication and ischemia.
Man, my list is getting longer. But the good news is, gang, that look, a lot of this has been, I know some of it gets a little bit heady, but the bottom line is that there's not anybody listening that doesn't have one of these symptoms. Whether or not it needs attention, that's for you to find out. And there's an easy road to do that, Doc. I do know that initially when somebody says, I don't know if I really need anything, but I heard the show, my aunt was this, my uncle was that, my mom is this. I think it's my turn to get evaluated. Isn't that the biggest step in the right direction people could take, get evaluated?
Yes, and again, I mean, if there's anything that we try to stress each time is that, if you're having an abnormal symptom, if you're having something that hasn't happened before, then probably it's not normal, and you need to have it looked at. For instance, in kind of getting into the crux of this with respect to arterial insufficiency, if you have a lack of blood flow to the heart, for instance, that's going to cause things like chest pain, shortness of breath, maybe weakness and dizziness, maybe nausea, sweating, those types of things. So those are symptoms of a lack of that, or those can be symptoms of lack of blood flow getting to the heart. which is a very, very important thing, something that you should not ignore. If you're having especially exertional chest tightness or chest pain, you need to go see your doctor because that may be a sign of an impending heart attack, which, as we all know, can be fatal.
Absolutely.
And at the very least, certainly something that needs to be looked at. With respect to the circulation into the brain, I mentioned carotid arteries before. Carotid arteries are the arteries in the neck, and the carotid arteries are the main, arterial blood flow into the brain. And when there's a lack of blood flow into the brain, one very, very typical thing that can happen with respect to that is a sudden loss of vision. And, and what's happening there is that a little piece of a plaque from an artery in your neck might break loose and be driven upstream into the brain, and a sudden loss of vision. And it may not even last that long. It may just last 15, 20 minutes, and then your sight comes back. And it's surprising at the number of people that will ignore that symptom. Well, that symptom can be a sign of potential stroke, impending stroke, and again, should not be ignored. And if I could convey anything to people as it relates to arterial problems, it's these types of what might be considered minor kind of symptoms, but have so much significance and need to be reported to your primary care doctor.
Yep. And gang, we like broke the fun meter a long time ago. Thanks for joining us. We'll see you again next time right here on on the Vein Clinics of Hawaii show at veinclinicsofhawaii.com.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.